What's up, guys? Welcome back. Today we're talking about issues with children in the wilderness for WFR 2025. So, there are some key differences fundamentally in adults and children. Obviously, they just have smaller bodies. They also have a larger surface area to mass ratio, which I will get to why that matters. Their head takes up a larger proportion of their body. That head itself is softer, like the cranium, the skull. The bones that protect the head is softer. They have pretty different normal vital signs. So this is super important when checking, obviously, heart rate, respiratory rate. For infants to children, their heart rate and respiratory rate do sit quite a bit higher naturally than an adult's. So that is just something to keep in mind. And then they also have limited communication and bodily awareness, so it's harder to know if something might be going on inside that you can't exactly see from the outside. Next up, we're talking about CPR for infants and children. So, just like they have different vital signs, you should do CPR in different ways for infants and children. Everyone does take the same ratio of compressions to breaths, so 30 compressions, 2 breaths. It's the same for adults, kids, infants, but there are some differences. So for babies, you want to take extreme caution. Don't shake the baby when you're trying to see if they're conscious. We don't want a shaken baby. So you just tap the soles of their feet instead. Instead of at the neck, you'll check for the pulse at the inside of the upper arm. And for a baby chest compressions, you want to use 2 fingers or both your thumbs at the center of the baby's chest. And when you're giving breaths to the baby, you want to put your mouth over there, or your mask, whatever you're using, over their mouth and nose. And instead of giving them full breaths, it's recommended to puff air into your cheeks to give them breaths. So that's for infants. And then for children, which is anyone up till puberty under 121 pounds, super specific, the chance of survival for kids who get CPR is higher than adults. Just healthier, younger hearts. For kids, depending on the size, you can use 1 or 2 hands. And it's just recommended to make sure you're not tilting their head back too far. So some of the most common injuries, one of them being the green stick fracture. So we know about this one. Kids' bones are still kind of bendy, more pliable, so it causes this weird kind of not full break, like the green sticks from trees, how they kind of just bend. And these often are incorrectly dismissed just as sprains because they cause not as much swelling or crepitus as a normal break. Also really common in kids are growth plate fractures, which are also usually incorrectly dismissed as a sprain. And something interesting I found out is that a sprain in a child is rare. It usually is a fracture of sorts. So these are important to look out for. And the growth plate fractures will happen usually at the ankle, knee, and wrist, those joints. Thermoregulation. So, that is me and my bro as a baby. Kids are always wrapped up like marshmallows in winter, which they should be, because kids are actually less efficient with thermoregulation than adults are. A lot of these issues that I'm going to talk about have to do with that larger surface area to mass ratio. So, like, for example, a 7-pound baby has 2.5 times more body surface area per unit weight than a 140-pound adult. So, kids, they will acclimatize to hot environments slower than adults. They will get colder faster in cold environments, and they'll get hotter faster in hot environments than adults do. And this does have a lot to do with also less body fat insulation and just like less sweat. They have a lower capacity for evaporative cooling, probably because of less sweat volume, regional differences in sweat patterns, and a higher sweat point. This puts them at risk more likely for hypothermia and hyperthermia. So you really just got to be checking in with the kids often and making sure they are appropriately dressed for the weather. Kids love just jumping in puddles. Make sure they're in some water wicking clothes and lots of layers, drinking water enough throughout the day. Something that tends to happen is the adult will feel warm, especially for babies. Like if they're carrying the baby, the adult will feel warm, but obviously since the baby's not moving, they will much more likely be cold. So you really got to bundle that baby up, because also infants have an inefficient shivering mechanism, which is like literally how humans have evolved to keep ourselves warm. Babies just don't really get it yet. So keep watching over those kids in extreme weather. Honestly, any weather. Infections. Kids always seem to have infections, and it's true. They do experience more, about 6 to 8 per year, versus an adult on average will experience 3 to 4 per year. This typically also can cause more severe symptoms than in adults, and this is kind of common sense, but it's still kind of cool to explain. It's usually because the younger a kid is, the more likely that this infection is the first exposure they have to this pathogen. And a first exposure is much more likely to cause a fever and more severe symptoms than if you were to get it for the second or third, fourth time, because you don't have antibodies built up from exposure in the past. And then in addition to that, the pediatric bronchioles, Eustachian tubes, and larynx are narrower, so they can much more easily be obstructed by edema and mucus. And this, in turn, worsens symptoms, prolongs clearance of infection, and increases risk for secondary infection. And a classic example of this is pertussis or whooping cough. About 20% of babies with this have severe complications such as apnea, pneumonia, seizures, whereas when adults get it, it's usually indistinguishable from just your common cold. So it's super important to just be aware and diagnose and treat early for kids, because they don't have the same immune system that we do. blunt trauma. So this is the leading cause of morbidity and mortality, so injury and death, in children 1 to 18 years old. Kind of crazy. Closed head injuries, so like a TBI where the skull remains intact, are responsible for almost 80% of pediatric trauma deaths. So mainly these would be pedestrian and motor vehicle accidents, but close behind include falls and drowning. A big reason that blunt force trauma affects children so hard is because they just like have underdeveloped bones. So especially the cranium, there are those soft spots on babies that can take up to 2 years for the skull to fully close. Those spots are called fontanelle. And luckily these soft spots do have a plus. If a baby has head trauma and there's intracranial pressure or swelling, they create less of a hard buffer, so usually puts less pressure on the brainstem where an adult would suffer from this. Additionally, the rib cages are more pliable, so they provide less protection for the lungs, and the smaller airway is more prone to obstruction, specifically from their tongue is just, I don't know, I think the tongue grows like faster than the rest of their airway and mouth does, so just comparatively it's kind of big for their mouth. So for babies and children, we really need to be careful about all this. They are more sensitive than we are, and they don't always know it. They may not realize what they're going through, and we may not realize either from the outside. So we really gotta keep an eye on our kids and keep them bundled, keep them hydrated and full and moving around and having a good time, just like this little boy in the bottom, little honey bun. All right, thank you. Bye-bye.